What is the syndrome of Gianotti Crosti? Blisters and a papular rash appear on the skin of the legs, buttocks, and arms in Gianotti Crosti syndrome, GCS, a rare pediatric skin condition. Skin lesions commonly linger for a few weeks and are at least 10 days long. The lesions are frequently accompanied by an underlying sickness, usually a virus, which may cause comorbid symptoms such as sore throat, a low-grade fever, or symptoms of an upper respiratory infection. Patients with GCS who are infected with hepatitis B, Epstein-Barr, or cytomegalovirus, CMV, may also develop acute hepatitis. It is believed that the hypersensitive response to the underlying infection is what causes GCS. In many other countries, hepatitis B is typically the underlying cause, although this is rarely the case in North America. Diagnosis: Gianotti Crosti syndrome is clinically diagnosed. The following is a list of validated diagnostic criteria. Gianotti Crosti syndrome is identified in a patient if he/she demonstrates all the beneficial clinical qualities on at least one time or during a clinical contact. Nothing in the differential diagnoses is thought to be more likely than Gianotti Crosti syndrome based on clinical judgment, and if a lesional biopsy is done, the histopathological findings are consistent with Gianotti Crosti syndrome. He or she does not display any negative clinical features on any occasions or clinical encounters related to the rash. Clinically advantageous traits include pink-brown papules or papulovesicles that are monomorphous, flat-topped, and 1 to 10 mm in diameter. At least 3 of the following 4 locations were affected: the buttocks, the extensor surfaces of the forearms, the extensor surfaces of the legs, and the cheeks. Having equal sides and lasting at least 10 days. The clinically undesirable traits include scaly lesions and extensive truncal lesions. Treatment: there may be no need for treatment because Gianotti Crosti illness is a benign and self-limiting disorder. Controlling itching, symptom alleviation, and preventing additional problems are the main goals of treatment. Oral antihistamines or other calming treatments, such as zinc oxide or calamine lotion, may be used to relieve itching symptoms. Antibiotics might be needed if any related conditions, such as streptococcal infections, exist. Mandy Moore, actress. Actress Mandy Moore has disclosed that her son August, also known as Gus, too, has been identified as having the rare skin disorder known as Gianotti Crosti syndrome. Gus woke up with a crazy rash last week, according to Moore, who posted about it on social media on Friday. Possibly an eczema flare, we reasoned. Poison oak, on her Instagram stories, she remarked, allergy. We tried to figure out what it might be and did everything we could to help him get some relief from the itch. According to the This Is Us star, Gus was transported to an urgent care facility, and after seeing a pediatrician, dermatologist, and finally a pediatric dermatologist, Gus was given the diagnosis of GCS.